Fascinating talk. Thank you for that. I've got one question myself before I open the floor for a few questions. You work on the science policy interface. You've got a room full of researchers here. What's your ask of them to make their research more open, accessible, and useful to you?
Okay, so we work also obviously in medicine as well, health, treatments and so on. And I think one of the things that is been a lot of debate in that area, and we have been pushing very hard as a charity, but I think applies here as well, is that actually the agendas for research, the shaping of research, and the results of research need to kind of be much more co-designed so that we are getting research that is fitting with what people need, what people want, and that they can take and utilize. So I guess my kind of ask would be, let's continue to work together to really get the kind of research that we think is going to make the difference. That's not to try and close down innovation in research. I'm very aware that, lots of great things come out of kind of, you get blindsided by them. But I think, that co-creation in terms of what is the research agenda, what are the unmet needs, what is the way in which we can sort of think right up front how that might flow through to advocacy, policy change, individuals taking it into their lives would be really, really helpful.
Okay, opening up for any questions. Just wait till the microphone gets to you.
Present. There we go. Look at that. Thanks, Robert Bradburn from the Environment Agency. Thank you for bringing some of those stories. It's incredibly powerful. I'm really interested in how we communicate and the impact that communication has on real people. And it sounds like you've got an amazing data source there in your survey. And I'm just wondering, does the survey go into how people get their information about this? Because, of course, you step out of the door, and what you smell and sense is not necessarily what is good for you.
That's a very good point. I don't think so. One of the discussions we had was, because I'm quite new, I don't know everything, obviously. And so I did say that I have got a team in the audience who will be able to sort of answer that question. But I'm pretty sure we didn't ask that issue, did we? We did? Oh, right. I don't know if we could get the mic. We're just going to get the mic to you, Livy. So there we go.
Thank you. I was just saying we do ask around the policy solutions that people would like to see, but not necessarily how different types of messaging are resonating with them. And very much because it's self-described experiences, we then can't use that data to say, well, this percentage of people with lung conditions are impacted by toxic air.
I think one of the other things I would say that we're really interested in is making sure that increasingly we can get a kind of core respondent base that reflects the entire population. We do know that, in common with many, many organisations which are trying to do public surveys, it's probably skewed. Well, it is skewed, let's face it. And so we are going to be looking very much at getting much more nuanced information from the communities that we know are most affected. And in turn with that, we know that we are going to have to be communicating in a much more nuanced way with those communities in the ways that they, will sort of understand that they, in their kind of context, and that's something that all charities are going to have to get much better at.
Thank you. Matthew Hort, Met Office. Thank you for a very inspiring talk. My question goes back to right at the beginning of your talk, where you said that the UK is the worst in Europe for lung conditions. And I guess my question is how much do we know about the why and the what is causing that? So are they sort of, you know, how much is the, if you like, known issues, and we can target those areas, thinking of bang for buck type things, and how much do we think we're still not understanding?
Oh, it's going to be a mega. It's almost as complex as doing a weather map. So I think one of some of the things that we do know about, we're very poor at diagnosis in this country, and we've got a lot worse in the last 5 years since COVID. So a lot of the spirometry that would have been done for diagnosis, you know, is barely recovering from pre-COVID conditions. We know that people are not getting through to get diagnosed either. So a lot of people, maybe they don't recognize it in themselves. So you will hear about people who've had, you know, essentially major sort of lung conditions for a long time, coughing really badly. They just think that's normal. I'm surrounded by people that do that. There's a nihilism in it all. So I think that's one of the issues. Some of the issues related to that poor level of public research, the management of people with lung conditions is quite poor. There's not enough research in that area. And we don't sort of serve people very well in this country in terms of helping them self-manage. I think there's probably better access to that. The impact of the environment, I don't know. I don't know that we can, whether we could say, okay, we know that air quality in the UK is so much worse, so that must be part of it. Or possibly more likely, the quality of our homes and the, you know, as we've all seen, those terrible stories about mold and the poor housing stock, how much that's a factor. So very, very difficult to answer.
Can I keep going, Gary?
Yeah, go on. You can do one more.
One more question.
One thing that I know for a fact that certain people in this room have been on the receiving end of is when you get, shall we say, groups that are opposed to, any further action on air quality, and adopting a stance which can be best described as anti-science, so trying to discredit the evidence and things like that, but still getting a certain amount of penetration amongst the general public who seem convinced that this is all a big socialist agenda or something like that. I don't know. But I'm just wondering what your take is on that and how best to counter that kind of thing. Because as scientists, we tend to be very polite about this kind of thing. You know what I'm saying?
Yeah. Well, let me relate it partly to my own experience of living in a city where, the sort of active transport, 15-minute city, low traffic neighbourhood type thing has been going on. And it's been, for me, it's been fascinating listening to that debate and really hearing it from the local people, my neighbours, my local shops, etc., and the impact that they were talking about on their businesses, etc., etc. And we had external people coming in from outside who were deliberately stirring up trouble around that issue. Now, I think we shouldn't confuse noise with numbers, and I think there is a lot of noise from a relatively small number, not the majority, actually, of the country in terms of these issues. A lot of people recognise the impact on their lives, and I think sort of talking to them about that and in ways of talking about how you can improve their lives without necessarily sort of denigrating their objections when they initially, talking to them about why do they think this is going to impact poorly on them. What are the issues? And I'll give you an example I was talking to somebody yesterday about. So in my area, the low traffic neighbourhood meant that some roads were being cut off, and people were having to go round longer distances, and the taxi drivers were all up in the air about it. They were absolutely furious. And so some people were unable to get a taxi to the local hospital for their appointments, and they didn't have a local transport mechanism. Now, and they were furious, obviously. Now, we need to sort of recognise that there are issues. We equally need to not be polarised, and we need to engage in discussion and debate and conversations with people, but where they're at as well. We need to do that very, very locally. So I think there is a local agenda that we need to pursue using all kinds of community action groups to show in the end, for their children, this is the right way to go, and we can do whatever we need to try and mitigate the real impact on some people's lives. So it's very difficult, but the one thing I would say, don't confuse noise with numbers.